Keeping an eye on your health tonight. We all want to stay well, right? You want to feel good, especially when it comes to our heart health. But what numbers do we need to pay attention to? What do they mean? It can be confusing, let's be honest, especially during a doctor's visit. And joining us tonight, speaking of doctors, we have a medical expert. Dr. Subhash Banerjee is with us. Thank you for being here. For those watching at home, it's an interventional cardiologist. That's what you do at Baylor Scott White. And let's start with the basics. And let me throw a big umbrella over this whole thing. Numbers in general when it comes to heart health. Why do numbers matter to even begin with?
Great question, Doug. Numbers simply mean understanding 4 individual facts. That is your blood pressure, cholesterol levels, blood sugar, and I would throw in there body weight.
And body weight.
Yes, and I think these are simple but yet enduring markers that can predict the risk of heart attack, stroke, development of peripheral artery disease, and also diabetes.
Okay, and tonight we're talking to everyone, man, woman, it doesn't matter, but I like the fact, candidly, I'm going to be a little selfish, that 2 dudes are talking about it, because at the end of the day, I think dudes are some of the ones who tend to not pay attention to those kind of numbers and information. So you mentioned blood pressure, you mentioned cholesterol. Specifically, tell us about the numbers that we're looking for with those 2 and the whys behind that.
Great question again. So let me start off with blood pressure and get off with the numbers. Is that the 120/80 is the normal blood pressure number.
Okay,
so,
and it's been that way a long time.
Actually, yes, it has been, but it's not often recognized. So if someone's top number, which is the systolic number, is above 130, or the diastolic number or the lower number is above 80, and it is persistent, that may already indicate the diagnosis of hypertension. So one needs to be careful in that.
And what's happening in the body, real quick, when those numbers are higher? Are the arteries, are they being constricted, or is there a lack of flow through there?
Well, that's a
general
very
understanding for us.
Fairly complex question, but to simplify, the injury to the arteries is magnified. Okay. And the heart works under greater stress. Okay. So from both those angles, it's not very productive.
Okay, that I can understand. So the cholesterol number now, right? For some reason, the number 200 pops in my head. What is that?
I think you are 25% right there. So the total cholesterol number should be preferably be under 200. Okay. The bad cholesterol, or the LDL cholesterol, should be preferably under 100. The good cholesterol, or the HDL cholesterol, should be preferably above 60, and the triglycerides under 150. Now, I would add a caveat that based on risk factors and some pre-existing conditions, the LDL value target can change. Okay. Now, there is one novel risk factor for cholesterol that is called lipoprotein A. It's fairly recent being tested. It's a one-time test in life and can predict the risk of premature heart and vascular disease.
And that's something you can obviously discuss with your doctor to have that as part of your blood test.
Absolutely.
Diet, exercise, we've heard it our entire lives. You have to diet, you have to exercise. But you can truly manage a lot of what you're talking about right now through those 2 elements.
Despite all the technology, I think diet and exercise can play a pivotal role in ensuring one's heart health. Now, low salt, limiting your intake of saturated fats, carbohydrates, of course.
With the carbs, here we go.
Refraining from alcohol.
I'm a carb freak. Yeah. I'm admitted carb freak, but limiting them is a good
limiting
idea.
Alcohol and completely getting rid of tobacco-containing products. This, combined with regular exercise and an active lifestyle, can do the trick with some
doctor,
sleep.
Is that often one of the first courses of action? If I come to you and I've got high blood pressure, and I'm not on the verge of a heart attack or something, let's say, God forbid, but are some of the first things you're going to recommend to me? Hey, what's your diet look like? Hey, what do you do for exercise?
100%. I think if the blood pressure is, say, minimally elevated above 120, like I mentioned, but doesn't reach the hypertension range, I think lifestyle changes can be very important, and that can self-correct your blood pressure.
Right. So, and then I'm not taking a pill every day.
Absolutely.
Right?
Absolutely.
Some really good advice here. Dr. Banerjee, thank you so much with Baylor Scott White. We appreciate you.
And thank you, Doug, for having me.
This is awesome. Good info.